We're here in Beaumont today, working with Professor John Burke, who's an international expert in rectal cancer and particularly in TAMAS procedures for rectal cancer.
The information that it's going to give us as clinicians is going to be hugely helpful going forward. And second of all, it's very nice to be able to contribute and help and support a colleague doing interesting work here in this country.
We will see how to register, how to follow the procedure during administering the ICG and the brightness, and we will calculate where to do the biopsy.
We're seeing for the first time the software working in action to characterize cancer in a significant rectal polyp in situ.
CLASSICA is a next-generation AI platform that detects cancer-associated changes in tissue perfusion, enabling real-time assessment of the malignant potential of bowel polyps and tumors. Founded by the European Union, this multidisciplinary international consortium has translated novel biological discoveries into software, ultimately intended for use as a medical device, SAMD, that is now undergoing initial clinical evaluation in several countries. The software works in real time by extracting and analyzing fluorescence time series signatures from dynamic endoscopic perfusion imagery.
Despite our best efforts and our existing modalities, whether it be endoscopy, clinical exam, biopsy, or radiology, we often find it difficult to determine whether a rectal lesion is benign or malignant. If it's benign, we might do a submucosal dissection to preserve the muscle, whereas if it's malignant, we would do a full thickness excision, and that can be curative for the patient.
The surgical team annotate areas on the screen that are visually abnormal and those that are normal, and the smart software analyzes the perfusion differential between these two areas. The software predicts the likelihood of malignancy in situ and selects a target area of likely best yield for a focused endoscopic biopsy.
I think it's probably the way of the future. To what extent it comes into surgery, it's probably hard to imagine at this stage, but I think it's all going towards assisted decision making for surgeons is going to be the way forward, whether that's identifying planes of tissue, identifying cancer, yes or no, or identifying structures or organs. I think it's only a matter of time before we have assisted decision making in theatre in pretty much every case.
By establishing greater confidence in the exact nature of the lesion, personalized intervention and care can be enabled and optimized.
And to be able to use this technology to inform our decision within the operation, to tailor our operation, is really the crux of why we're doing this study.